Meinie Nicolai, as the president of Médecins Sans Frontières Belgium, you obviously have a huge crisis on your hands with the rapidly, it seems, expanding Ebola crisis. It's the worst since 1976. Some 5,420 people have died. What more can you do?
Yeah, this is an enormous crisis. This is an Ebola epidemic that we've never seen before. So what we need to do now, because it's in the three countries, and the epidemic is spreading inside the country. So the disease is moving. So what we need is not to focus on the old sites, but adapt ourselves to where the virus is moving. So to give an example, in Monrovia, for instance, the number of cases seems to go down. But the interior of the country we have to follow very closely. In Sierra Leone, the disease is moving from the west to the east part of the country. So these are examples where we see, and you need only one case to reboost in a village, in an area, a new epidemic. So as long as it's around in the three countries, all countries are at our concern. And so we need adapted, flexible approaches. That's what we need the most.
Why, in particular, has this crisis become, well, the biggest in history? What is it that's changed with the disease or the way that the disease passes? Is there anything that you can tell us?
No, we don't think that the virus has changed. Well, it will mutate, but we don't have a very clear view on that now. What was different in Congo? First of all, the people didn't know this disease, so they were not used to it, and they were not used to change their habits. Then second, it's a highly populated area in three countries where people moved between the three. So if you want to address the epidemic and you have to deal with three different countries with their administration, etc., makes it more complicated. Then a third element was that it went to big cities, so it didn't stay in rural areas. So it's been people have been moving, and it went to Monrovia and Conakry. And then the people in West Africa care a lot for their sick and care for their deaths. And that is an element that has spread this disease.
Because as far as I understand, thankfully, it's not airborne. Obviously, that would be a worst-case scenario. Is there a chance of it going airborne, do you think?
No. This virus is a virus that likes fluids and that replicates very quickly in the body the more you get sick. So you're very contagious at the end of your life, when you're about to die and when you're dead. Then the virus is multi-present in your body fluids. And the people who care for you, that's why this virus is so ugly, because it will transmit to those who care for those who are sick. So family members and health staff. So there is where the virus spreads. It will not become airborne.
Do you think, therefore, that there is hope of making sure this virus comes to this crisis comes to a happy conclusion? Is there a chance of that?
Well, a happy conclusion, I don't think, because 5,000 people have died. There is no happy conclusion, but I believe that we will beat it, but it will take time. And we need a vaccine that can protect people. And of course, we need medication that we can care for the sick. But I do believe that we will hopefully bring this under control, but it will not be a happy end.
Pauline, you are an institutional capacity building volunteer for the Voluntary Service Overseas, and I believe you've been there for 7 years in that position. How does human capital feature in the work that you achieve?
Okay, in institutional capacity building, human capital is basically the first form of way of building capacity, because you need someone whose capacity has been built, mainly who has the technical expertise, to be able to go down and build the capacity of someone whose skills do not meet what you need. Other than just that, in capacity building, we talk about two things. We talk about capacity building, which involves individuals, and institutional strengthening, which involves strengthening or developing the systems and policies and procedures of organizations. And the only way you can build institutional capacity is using human capital.
You're also very much involved in health work, in the work that you do. The Ebola crisis must have had a huge impact on what you're doing. Is that the case?
It's had a huge impact on what I'm doing, but from a distance, because I mainly do not deal with Ebola. I've dealt with HIV and AIDS, and currently in Kenya, we have not had any cases of Ebola, but we have had changes, health responses towards preparing the Kenyan population for the Ebola crisis. And some of the things that are being done is there's been a lot of screening in the airports coming in, as people come in from different parts of the world where there's been the Ebola crisis. Also, there's been a lot of health education to the Kenyan population on what is Ebola, how do you transmit Ebola, and how do you protect yourself from getting Ebola. The reason being, one of the main airlines in the country, that's Kenya Airways, used to do daily trips to West Africa, the countries that were greatly affected by Ebola. And there was a panic state in the country at one point when there's a patient who came in, and there were rumors around the airport that the patient had Ebola. So as a health response, the government actually took a quick, fast initiative on testing the patient. By then they had already set up isolation rooms. They'd also set up an area where they could screen patients who are coming in. And as a result, they had to reassure the Kenyan population that the patient did not have Ebola, and they had to also aggressively continue with the health education. Also, they have tightened the borders because people don't just come in through airports in Kenya. We also have borders through other countries. They've also tightened the health checks and security at the borders to ensure that every individual coming in is screened for Ebola.
Jim Emerson, you are the Chief Executive of Voluntary Service Overseas International. The theme of your debate today is human capital and how it's leading development. What exactly do you mean by this?
I think we mean that the sustainable development can only happen through people and with people. And that at the same time, sustainable development then the results of sustainable development are measured by their effects on people. So people are both the means and the end of sustainable development.
Do you believe that sustainable development is playing a role in combating the Ebola crisis?
That's a difficult one to answer. I think we've seen that the situation that has developed over the last 6, 7, 8 months in Liberia and Sierra Leone is actually taking away from the results that have been achieved over the past few years, particularly in the case of Liberia, come out of a long civil war. Major improvements over the last few years, a lot of encouraging signs in the country and a lot of investment made, and the Ebola crisis is now a real setback and is negating some of the benefits that have happened in that country over the last few years. It's also an indictment, I think, to the international community that we have been quite slow in responding to the Ebola crisis, and that we have, to some extent, allowed it to get to the extent that it has got to over the last, particularly the last 4 months.
Your organisation works in more than 58 countries and apparently reaches out to more than 15 million children. Surely that's a positive outlook for the future?
Of course, yes. We don't actually work in 58 countries, if I can correct you. We're more like 30 countries. But yes, we do reach out through individual contacts we have, through lots of partner organizations that we work with, and through many community groups. And we do reach out to a significant part of the population in many of the poorest countries.
So what is VSO's next step then? Following on from the debate today, what would you like to see VSO doing more of?
More of what we've been doing, and extending the different types of volunteering that we offer. So when VSO started initially, it was young people volunteering after a gap year or just qualified or just out of university. We've seen over the last 50 years that the average age of our volunteers and their technical qualifications, their proficiency, their expertise has increased significantly. We've reintroduced the youth element to our portfolio. We are now looking at how can we engage the corporate sector in volunteering activities. We're looking at e-volunteering initiatives. And there are many, many other opportunities for people to get involved in volunteering and becoming active in their countries and their communities and in the world, in working to address many of the issues that affect children and adults and fighting poverty.